Okay, today we are going to talk about the cardiac cycle and how actually the heart beats. As you know that your heart beats about 60 to 75 per minute. So it is a rate. When we measure something over time, it is a rate. You can actually measure the heartbeats by pressing on some areas on your body, such as against your wrist, against your neck. You can feel the heartbeats here and you can measure it over time to find the rate per minute. There are reasons actually behind measuring the rate against these areas. The first reason that these areas are near the surface of the skin. They have arteries with high pressure. Arteries with high pressure near the surface of the skin. The second reason that they are against bones or tendons. When you press on them, you are pressing against something which is hard. That's why you can feel it. Artery with high pressure near the surface and against bone. That's why you can feel it. Now, this is what we call it the pulse. Pulse, how many beats per minute? We call it pulse. When you go to the doctor, the first thing he does that actually use a stethoscope, something which is used to measure your heart beats. By the way, when someone actually has heartbeats less than 75, around 60, 65, which is something good, that means that this person is healthy and athletic. Because the blood actually pumps, the heart pumps more blood at once. So no need to pump about 70 or 75. The heart can pump less than this with more amount of blood being delivered to the cells. Now, the sound of your heart, it is called lop and dub. You feel something like lop, dub, something which is high and something which is low. This is what we are going to talk about, which is called the cardiac cycle. Here, as we see, it is a stethoscope, and here also we have electrocardiograph. Electrocardiograph uses electrodes. These electrodes in order to see how your heartbeats are going. Now, before talking about the cardiac muscle, also we should talk about why heartbeats increase sometimes, or why does the heart need to increase the beats. Sometimes when you work out, you do lots of exercises, then your cells are respiring, they producing carbon dioxide. Carbon dioxide dissolves in the blood plasma, which makes hydrogen carbonate ions. Hydrogen carbonate ions are acidic. So the pH of the blood is lowered. This actually means that the body at risk. This sends signal to your brain to increase the heartbeat. And the heartbeat actually is controlled by a patch of muscle. This patch of muscle is called pacemaker. It is found on the right side of your heart. It controls or coordinates the heartbeats by receiving signals from the brain. Also, they send signal to the heart to beat at a specific pattern. If something wrong happens with the pacemaker, then the heart cannot beat properly, and sometimes an artificial one is used. Sometimes an artificial one is used actually to in order to control the heartbeat. It may stay for 10 years, so it is replaced every 10 years. It's okay, nothing gonna happen. It's like electrical. It sends like electrical pulses to the heart. Now, let's talk about the cardiac cycle. You have to know when we hear the dub, one is high, one is low, which one do you think is the high? The contraction of the heart to pump blood out, or the relaxation? Which one do you think is high? Of course, it is the contraction of the heart. When the heart contracts, that means that the pressure here is high. So at this, now the heart contracts, pumping blood away, and this is what we call it systole. We call it systole, when the blood is being squeezed by the heart. Now, when the blood relaxes when the heart relaxes in order to receive blood, we call it diastole. What do we call it? Diastole. So systole is the contraction of the heart. Diastole is the relaxation of what? Of the heart. Let's look at this. This is the cardiac cycle. As we see, first of all, the blood should be relaxed. Actually, it is relaxed here, most of it relaxed. The atria and the ventricles. But the ventricles actually are relaxed the more here. So at this, the blood gets into the heart from lungs. Where does it go? It is received by atria. So the atria now are relaxing, getting blood down to the ventricle. The first picture, look at the first picture here. I don't know if it is shown, the one that you have it in your guideline. Okay. By looking how the blood goes into the atria, so the atria now should be relaxed in order to receive blood. Once they are relaxed, they pump blood to the ventricles. Also, the ventricles should be relaxed. But once the atria pumps blood, the atria contracts. Do you see how, number 2, how the atria contracts here? When the atria contracts in order to pump blood, now the valve, it closes. The atrioventricular valve should close in order for the blood not to get back again to the atria. Now look at this. Now the ventricle here is relaxed. Do you see number 2, the second one? How the cardiac happens, the cardiac cycle. Number 2, the ventricle, in order to receive, it should be relaxed. So when the ventricle relaxed, we call it ventricular diastole. Okay, in order to receive blood. Now, number 3, the valves, look at the valves. The valves are closed now. So, the ventricle should squeeze on the blood in order to pump it out. When the blood is pumped out, now the ventricles are contracted, and what we call it ventricular systole. Ventricular systole. And this actually, when the ventricles contract, they cause the contraction of the whole heart. We feel that the heart is squeezing because ventricles actually, when they squeeze, they should pump blood at high